Over the next 3 days, about 150 volunteers, community leaders, and other health professionals have gathered for a special summit on the fight against HIV/AIDS. The event is being held at the Hyatt Hotel and organized by the Department of Public Health with a Pacific Island Jurisdictional AIDS Action Group. Co-chair Kiki Stinnett says their goal is to look at the HIV/AIDS epidemic in the Pacific and analyze data trends. She mentions they also want to improve prevention and care efforts because those are key to reducing cases of HIV/AIDS and sexually transmitted diseases. The Chook Women's Council president adds the biggest challenge they face is educating the public on these diseases and to practice safe sex.
The community awareness is very important in educating people what is HIV/AIDS and how is HIV is transmitted.
Another big component of the summit is focused on West Care. Risk reduction counselor Kelly Jensen says they are the only AIDS service organization in the Pacific.
So we offer free HIV and STD testing, and we've just started our Clearview rapid testing for HIV. So if people want to come in and get tested, they can stop in our office and they'll know the results in about 20 minutes.
She also talks about other programs that have helped improve the awareness level on Guam, like Project Desata, catered to work with girls ages 9 to 17.
In the last month, we actually had 6th, 7th, and 8th graders who a month ago didn't know what HIV was or how it was contracted, and every single one of them knows at this point. So we're really, really proud of the project, which will continue through May.
So where is Guam at in prevention efforts? Public Health STD/HIV Program Supervisor Bertie Schumann says since 1985, a total of 233 HIV cases have been documented, and there's more for 2012.
This year alone, which is 2012, we have new cases, a total of 9 new cases of HIV. Most are among men. Actually all 9 are men.
Schumann says public health is greatly concerned about these numbers, especially with the amount of STD cases being reported as well. She mentions the island's chlamydia cases are higher than the U.S. mainland.
Since 2009, we started a chlamydia and gonorrhea screening project, and out of this total 3,000 tests screened for gonorrhea and chlamydia, we're seeing a 24% positivity rate of chlamydia, which is pretty high compared to the mainland. So we're concerned about that because both HIV and chlamydia, require the transmission is through unprotected sex.
She adds the focus is on 15 to 24-year-olds because that's where the highest chlamydia cases lie. Another problem they are monitoring is Guam's growing syphilis epidemic.
Earlier this year, we had identified syphilis cases among males as well, and we want to make sure that all those males that we have identified are given the proper treatment for syphilis, and also identify their partners. So it's really important to think about, seeing your doctor, ask your doctor for an HIV test if you can.
The summit ends on Thursday. For more on STDs and HIV, log on to protehihao.org. Josh Tikenko, PNC News.